Thank you, Zoe. We already have a number of people who've already joined us today. So welcome, everybody. And as you're joining us, please use the chat box and share with us who you are, where you're joining from today, and the one thing you're currently doing to look after yourself during this challenging time, and send it to all participants. I'm excited to listen to today's session where we'll be focusing on recovery for our people that will help us support the recovery of the services we need. So really, really excited today. And we've also got a great lineup. So please share with us as you join who you are, where you're joining from today, and the one thing you're doing to really look after yourself during this challenging time, and share that with all participants.
So Elizabeth, as they're coming in, what have you been doing to look after yourself?
Lots of exciting things, Zoe. I've now moved from doing just boxing, I'm doing kickboxing, and I love that. I feel like I've upgraded to kickboxing, and I still keep to my running over the weekends as well. I'm really, really enjoying that. What have you been doing?
Well, I haven't been knitting because I made a mess of that. We've just been doing a lot of gardening. That's what we've been doing. And many of you will know who have meetings with us. We've had a puppy. So we've been doing a lot of walking in the rain, which is great. And yeah, just running around after a puppy. It's been it's been a lot harder than I thought it would be, to be honest.
It's keeping you fit.
Yeah, it is, definitely. We've got a few people saying hello in the chat box. So Jan Carter, hello Jan. Jan's from South Gloucestershire, working from home today and been doing a daily walk. We've got Zara, hello Zara. Zara's helping us on Twitter today. And Zara's part of the Horizons team, and she'll be live tweeting the session, and she's trying to go out for walks during the day, sometimes walking meetings with other colleagues. I love a good walking meeting.
Yeah, hello to Suzanne from Leicestershire. I'm trying to eat better and walk more. I struggle with eating better. I still have a packet of crisps here and there. Welcome.
So we've got Simon. Hello, Simon. You've just moved off my screen. Northumbria Healthcare Occupational Health, welcome. Max from Lancashire is doing some work on the allotment and cycling. So if you are just joining us, please do say hello in the chat box. We've got about 4 minutes to go. And yeah, just let us know what you've been doing to look after yourself.
Hello, Andy. Andy from Croydon. He's been taking photography and winning awards. I like that one. Ooh, might share some of the photos with us, Andy. Thank you. And we've also got Kathleen. Kathleen is from North London. Welcome. Kathleen has stopped drinking wine and booze and eating sugar. Well done. Well done for that. Yay. And we've also got Andrea from Essex. Welcome. Lots of people already joining us. So if you're joining, please use the chat box and tell us who you are, where you're joining from, and the one thing you're doing to look after yourself, and send it to all participants.
So we've got Moya. Hello, Moya from Northampton General, trying to be kinder to herself. I think we all need to do that. It's very hard at times, and we do need to be much, much kinder to ourselves. Hello, Katie. Katie's from Humber Teaching Foundation Trust. And Katie's been saying, I try to meditate regularly to look after herself. Terry is drinking lots of tea from Leeds. Was it Yorkshire tea, that direction? So as we join today, please do take a moment to think what you're doing to look after yourself. And during these sessions and after the session, there's loads and loads of ways that you can stay in touch. So we've got 2 people websites now. We've got a mailing list. We're on Twitter. So, and if you are on Twitter, then a couple of my colleagues are tweeting today. So please do use the hashtag caring4, that's the number 4, NHS people, and Project M as well. And you will hear about Project M today. So please do use those hashtags and tell us what you're thinking about the session.
Yeah, lots of people already joining us. Zoe, somebody has just complimented you on your geography up north. Well done. Hello to Philippa, joining from London. The GP appraisal lead in London. Welcome to today's session. And also doing a lot of photography to keep going. Thank you. Welcome to Caroline from Yorkshire. Lots of people already joining the session today. And as you join, please share with us who you are, where you're joining from today, and most importantly, what you're doing to keep yourself going during this really challenging time.
So we've got Caroline with us. I've seen Caroline on Twitter. So thank you for helping to publicise today. So Caroline's from the National Association of Primary Care. And she's loving helping the garden grow. So please do say hello in the chat box. Oh, Rachel.
Hello to Rachel from Sussex Partnership. Welcome. It's going so fast, one after the other. Welcome to Kerry from Connell. Lots of people already joining us. Carly from East Kent Hospitals, welcome. Are we live on YouTube as well, Zoe?
I shall ask my colleague Paul. I think
we are.
We are. So welcome if you are joining us on YouTube as well as Zoom today. Please do comment in the chat box and we'll bring that into the conversation as well. So yeah, please do say hello in the chat box, and we'll be starting shortly where we'll be talking about recovery. So who else have we got? Vicky. Vicky's from King's in London, working on staff recovery programme. So hope you can help out as well. What I would love is if we can continue to use the chat box in both Zoom and YouTube and share your thoughts on recovery as well. So without further ado, I'd like to welcome you to the NHS England and NHS Improvement monthly wellbeing event hosted by the People Directorate. And today we're going to be talking about the recovery of our people to enable the recovery of services. First of all, I'm going to introduce John Drew. John's the Director of Staff Experience and Engagement. John, over to you.
Hi Zoe, thanks, and hi everyone. It's actually my birthday today, so
happy birthday.
That's all right. My attempt at well-being is going to be to stop work for the day after this, which might not sound like a big achievement, but I can assure you in the current context, it really feels like one. So we'll see how that goes.
Well, John, you've got a lot of messages already coming into the chat box. It's filling up with happy birthday messages, so make sure you have a little look.
You're very kind, yeah. The idea that is discussed about whether the NHS should grant people's birthdays as an extra day of leave hasn't quite arrived in time for me, but I appreciate the good messages, so thank you. Yeah, a couple of things I want to just say to frame today. I mean, firstly, just to update you a little bit on the work that we're doing on people recovery, which is increasingly, and I hope you'll be glad to hear this, it's not just about how do we help people to recover well, but it's how do we make sure that that is entirely compatible with the approach that's being taken to the restoration of services for patients. Because in the end, that's also what will drive the environment that people are working in, maybe the pressure they feel, the time that they have available, etc. So with a lot of support and guidance from our expert advisory group, which Neil Greenberg, who you're going to hear from later, is a key member of that group. We've been making sure that we're applying the most evidence-based approach, if you like, to how we approach the recovery of people. And a good part of it is about giving people the time that they need to be able to reflect on what they've been through, both as individuals and as teams. And in the end, at the heart of that is that the process is a conversation, which I know that Neil's going to talk about. And that, I think, is a key priority for the year ahead, is how do we embed health and wellbeing conversations and how do we get really good at them? And a key part of that is obviously listening. But then there's also other things like the way we set trajectories for services to recover, the way what is written in the planning guidance, the way financial incentives work for trusts in terms of the activity they deliver. And all of those things obviously affect people's well-being in the end and their ability to recover. So I guess a key part of what we all need to do is not just get the part right that we're responsible for in terms of the people domain, but also influence our colleagues who are responsible for other things like planning patient services, planning at what rate they get restored, planning activity levels, looking at patient waiting lists, and that's all connected. So I guess what I would say is we're giving that absolutely our best shot to make sure that we are talking to colleagues responsible for those things. And I think it is really landing, and there is a kind of shared commitment to get this right. So hopefully that is an encouragement to you. And then the other thing I just wanted to do, I don't know if you've got it there, Zoe, on the next page, is just share some data with you that I thought might frame some of the conversation that we're having today. So most of you will know that there's a thing called the Pulse survey that we've introduced during the pandemic. And because of the take-up rate and how useful it's proven to be, we've now extended this. We've gone to procurement and we've agreed a supplier that will provide this for at least the next year with an option to extend to a second year. So far, I think about 120 organisations have registered to use it. And in the last wave, which is the 11th that we've run, there was a question put in about, have you had a conversation about your health and wellbeing in the last 3 months? And you can see that roughly 2/3, so 64% have said yes. And then we asked them, who was that conversation with? And basically, how useful was it and what's it led to? So this is, I mean, this is fresh data, and we might all have views on how we can interpret it. But what's interesting to me is that most people are having that conversation with their line manager, but not exclusively. And I think that's actually fine, because for some people, they'll be able to talk more openly with a peer or a person outside of their work, which could be a friend, it could be a member of their family. But then when you look at the data below it, it would seem to suggest that the conversation is more useful and makes a bigger difference if it's a peer or a person outside of work than if it's a line manager. And that, again, you might expect that, because it could be to do with how open people feel they can be. It could be that people actually can talk about things like financial worries that they have or relationship concerns with somebody outside of work, but they wouldn't feel comfortable doing that with a line manager. But I think it's a helpful reminder that we've got a good starting point to build on, in that most people are having these conversations, and you know, whoever it's with, people are saying it was useful. So around 70% are saying, look, the conversation was useful. But when you actually look at, and did it convert or has it converted yet to your health and wellbeing improving, the figures are much lower. So I think for me, it sets up today's session, because it says this is something that is really worth getting skillful at. You know, like anything else, if we practice it, if we learn tips, if we hear from experts, we're better able to do this, and we'll learn to do it better. Whether it's like baking a cake or playing tennis, the more you practice, the better you get. And I think that's the approach we should take to health and wellbeing conversations. This is a skill, and we want to get really good at it. And I really hope and believe that today's session will be a good starting point or a good contribution along that way. So thank you.
Thanks, John. So if you haven't joined one of these sessions before, welcome. We'll start with our aims, as we usually do. This is our 22nd event focusing on wellbeing, and the aims of these events is to offer support, ideas, knowledge and wisdom for those in a role in supporting the health and care of our staff. We're going to be sharing a range of wellbeing activities that are available to everybody. And what I do hope is that you can connect within the chat boxes, both in Zoom and in YouTube, where we're streaming this today.
So on our agenda today, we've already had a welcome session from John. Thank you, John. We will hear from Alan about Project M. Lots of you have been joining Project M on Twitter, and we'll also hear about the National Wellbeing Overview, and that will be from Steve Lee. And we'll have wellbeing conversation sessions by Reverend Andy Dovey and Zoe. And we'll also listen to a session about recovering our people to recover our services, and that will be from Professor Neil Greenberg. And me and Zoe will end by having some closing remarks at the end of the session today. And on the team, you've already met me and Zoe. We are your co-facilitators. And contributors, we also have John, who's led on the welcome session. And we will hear from Alan, Steve, Zoe, Reverend Andy Dovey. And behind the scenes supporting the session today, we've got our technical host, Paul. On the chat box, we've got Louise and Karen. And on YouTube, we've got Claire. And on social media, we've got Neil. Part of my screen, I could not see the top end there, and I forgot to mention Professor Neil Greenberg, who will be delivering the session today on recovery. So welcome, everybody. We're going to begin by listening to Alan, who is going to give us an overview on Project M. Alan is the Head of Design and Development at NHS Leadership Academy. Welcome, Alan.
Fabulous. Thank you very much indeed, Elizabeth, Zoe, and good evening, everybody. I just wanted to grab 5 minutes of everybody's time and really reach out to everybody out there, and not just to all of you on the call, but to everybody out there and everybody you know, particularly those of you who know people who work across health and care. And especially a huge welcome to anybody out there who is a team leader or a line manager. I'm struck that Teresa in the comments says line managers are under huge pressure right now and are saying so. And Project M, although it's for everybody, was really an initial experiment in trying to provide some peer-to-peer support, particularly for line managers and team leaders. If you could pop to the next slide for me, please, Zoe. And really, Project M has emerged as a new offer, cited in the leadership development space, but really with a health and wellbeing focus. As I said, particularly aimed at team leaders and line managers, really as a way to build peer-to-peer community and to garner support from other people like you experiencing the same kinds of challenges and problems as you might be, and to recognise and amplify the skill and the capacity you have to look after yourself and others really, really well. If you can pop to my next slide, please, Zoe. Probably Zara, I think, is managing this for us. Project M really just has a few strands to it. At the core of it is the virtual community. Apologies that slide hasn't come out quite as well. I'll share the original slide set after this. The virtual community has grown through Twitter, particularly using the hashtag Project M, and we have monthly tweet chats where people come together and share in and learn from each other. We've also got some online resources, however, at www.people.nhs.uk/Project M. There's also some social collaboration spaces at people.nhs.uk/groups. And we're really motoring now on trying to create energy for self-managed peer mentoring. And it's the peer mentoring element of this that I really wanted to just focus on this evening. If I could have maybe my next slide, please. So peer mentoring is really just an opportunity for people to come together in one-to-one relationships who share common experiences, a common sense of issues and challenges in the team leader, line manager space, and to either in that space and that time to offer support and guidance if I have greater experience or expertise or knowledge or skill, or to seek to receive knowledge, guidance, wisdom in an endeavour to help individuals as line managers and team leaders to really take care of themselves so that they can go about looking after their teams and others around them. Now, many people will be getting peer support in lots of different ways. Many people might be in mentoring relationships, and there's a whole range of different ways of garnering support. And we're going to be hearing more about that as we move into wellbeing conversations and our wider recovery piece. But we've been encouraging people through a Twitter campaign to try and signal to the world, particularly the Twitter world and other social media, if you are somebody who feels you have the capacity, the capability, and some time and space to provide some peer mentor support. And you can do that by wearing one of these fancy twibbons that you see here. And it states quite clearly under your Twitter profile, #ProjectMMentor. That's a signal to the world that you're willing to provide space, time, and opportunity to colleagues if they want to garner some support and guidance from you. If you don't feel capable of doing that, but you're actually up for having a space where you can get some support from a colleague, you can wear the twibbon "Mentor Me", #ProjectM. That's a signal to the world, the Twitter world particularly, that you're looking for somebody to reach out perhaps and ask and offer some support and some guidance. To date, we've had quite a great uptake of this. 108 people are already sporting their Twibbon Project Mentor badge, and 85 or so colleagues the Mentor Me Project badge. But one of the biggest challenges we have, and one of the biggest questions that we often face in this space is, once I put the badge on, then what happens? And really, it's over to you as a peer community. If you see somebody sporting the Mentor Me badge saying, I'd quite like to have some mentoring support, maybe find the courage to drop them a direct message and say, I don't know if I'm the right fit, but I'm certainly up for a conversation. If you're sporting the Mentor Me Project M badge and you do have the courage, if you spot somebody wearing the Project M Mentor badge, maybe find that courage to drop them a direct message and say, I see you're willing to offer some mentoring. I'd quite like some. I wonder if you and I might match, and see if you can't start the conversations. I know firsthand they're working. I've taken on some mentees, and I'm being mentored. I know some of my colleagues are doing that. And I see on Twitter on a daily basis, many people reaching out, many people being matched by themselves, for themselves, and many people reporting just how helpful it is to speak to somebody else who just gets me, understands my world, really knows what's going on, and it can be quite energizing. So I'd really encourage you, if you can be out there in that world, or if you know people who are in that world, get them to get their Twibbon badge on, get them to offer themselves or to find the courage to ask for help. We know now it's really working for people. So it's really just an encouragement and an ask from me. And what next from Project M? If I could have my final slide before I stop preambling. What's coming up for Project M in the next week or so? Well, we've got a Project M Tea and Talk. It's an informal get-together, 4 till 5 o'clock on the 16th of March. And if you want to join us, you can see how to do that there and where to register. It's just an informal get-together, chat with whoever turns up, have a coffee and a biscuit on your sofa in your office at home, wherever you might be, and just garner thoughts and learning. If you want to do something a little bit more developmental, you might want to join one of our listen and learn sessions. Our next one's coming up on the 25th of March. It's across the lunch period, 12:30 till 1:30. And the idea is grab your sandwich, grab your soup, grab your salad, go for a walk if you can put this on in the background, and just listen in to colleagues who come and share their thoughts and feelings about how, on this occasion, we might create conversations that promote a sense of well-being. And finally, our next tweet chat for all you #ProjectMers out there is on the 30th of March. We look forward to seeing you then if you want to join us once more, or if you want to join us for the very first time. I'll leave it there. It's been great to catch up with everybody and hope to see you somewhere in the #ProjectM space soon. Thanks, everybody. And back over to the team, whoever next is introducing Steve. Thanks very much indeed.
Thank you very much, Alan. I will definitely join the next tweet chat. So we are now going to listen to the National Wellbeing Overview, and Steve Lee will provide this for us. Steve is the Interim Head for Health and Wellbeing at NHS England and NHS Improvement. Welcome, Steve.
Thank you very much. I hope you can all see and hear me. I've got 9 slides and I've got 10 minutes, so this is going to be ambitious, but let's go for it. The first slide, which some of you may be familiar with, shows the current offer, the current health and wellbeing offer, rapidly approaching 800,000 interactions with this offer, be that for people downloading the apps or looking at the website, or undertaking training, for example, the REACT training to support psychological health and well-being. Let's move on to the next slide. So while we've got those offers in place, and they're kind of summarised there on the left-hand side, we're aware that we kind of need to think about the future, to think about how we can adopt and embed a preventive approach on health and well-being. And we're starting to turn our focus to 3 main areas. The first is to ensure that we've got that top level commitment, irrespective of size of organisation, to kind of see and to set kind of the tone for health and wellbeing and to help embed it. So that role is typically held by a health and wellbeing guardian in a large organisation. That would be a non-executive director. And they're supported in their role to champion health and wellbeing consistently through guides, through webinars, and a couple of webinars we've held recently. One was for trust, the other for primary care. Around about 500 delegates attended, and we've developed toolkits to kind of help underpin that role too. The next level down, we've spoken a lot about the role of line managers and teams, is to support health and wellbeing conversations. And those conversations are supportive, compassionate, and they happen routinely. And I'll expand on that a bit later. We also need to ensure that we deploy evidence-based interventions on mental health. So you may have heard of the mental health hubs. Over half of those are in place now, and we're intending for the remainder to be in place by the end of this month, 40 in total. Finally, on occupational health, we're keen occupational health becomes a much more integrated part of the preventive health and wellbeing work that we're doing. There was a conference today, the Health at Work conference, where we shared our ambitions for this work. And we've asked Steve Borman to work with the Faculty of Occupational Medicine, Society of Occupational Medicine, and other leaders in the field to develop a roadmap to see how we could enable that change to happen. So that's to enable occupational health to kind of gather intelligence and to feed that into the prevention cycle. Just quickly going back to that Guardian's role as well, we've commissioned the Health and Safety Executive to help the Guardians in their role by looking at both lead and lag indicators of performance. So lead indicators in this environment would be things like health and wellbeing conversations and whether your risk management arrangements are adequate for example, controlling stress or violence at work. And that combines with those kind of more traditional lag indicators that we see, for example, sickness, absence and presenteeism. If I could go to the next slide, please. So I'll talk a bit more about conversations today, and we see conversations as being a core part of recovery, which Neil, I'm sure, will expand upon a bit later. So if I could go to the next slide, please. So what is a health and wellbeing conversation? I'm sharing with you today materials that we'll be sharing tomorrow for a launch event of what we're hoping we'll achieve through the conversations piece. The guidance I'm sharing with you will be available from Friday, together with some animations and some talking heads videos. Andy will be featuring on one of those videos, and that's to help kind of bring this piece to life, to ensure that those conversations are supportive, they're coaching style one-to-one conversations, they're holistic, but we're not expecting line managers to be experts in every single area that I'm sharing here around kind of physical, mental, emotional support, financial support, but they should be able to help signpost and guide to those areas of expertise, and they'll be available on the website. And we're hoping as well the conversations translate into the compassionate care into patients and to other colleagues, and that really does form the kind of basis for why we're pursuing the conversations piece. If I could get the next slide, please. So who should hold a conversation? Most cases that will be line managers. However, that doesn't have to be the only person that you engage with. The main thing is that these conversations happen routinely as a matter of course. And again, you can choose. As an individual, you may wish to speak to your line manager, you may wish to speak to another colleague, someone else within the team, or somebody else outside of the team, just to check in and see if there are any available kind of avenues of help and guidance and support that can help you. Next slide, please. So in terms of what we're advising in terms of approaching health and wellbeing conversations, as I've said, and I will repeat this quite a lot, they should be happening routinely. However, you may also want to weave them into existing arrangements that you have. For example, one-to-ones, annual appraisals, job planning discussions, or team meetings and away days, just to check in, ask how you are as an individual, as a collective, to see what more you can do. Often these will be happening anyway. We're just saying that we want to see this as a consistent approach. So no matter where you go, you can expect to have a conversation about your health and well-being. I think that's particularly important when you're joining a new team, to ensure that people are checking in and looking after you. Next slide, please. So in terms of starting a conversation, some general tips that we'll be sharing is just to ensure you're in that safe space environment, and to ask the question, as John was saying, kind of to ask the how are you question, and to actively listen and to understand what's happening. People earlier today at the conference were sharing that they're doing things to kind of actively listen and to engage, putting your mobile phone away when you get into work, to ensure that you're actively listening and responding to needs. I think as well, a lot of the evidence is telling us that peer support and line manager support is critical for your overall health and well-being. So we think this is a really important piece for us to get right. Okay, next slide, please. And the final slide really is just some general good practice for health and wellbeing conversations. They should be supportive, caring and compassionate, ongoing and dynamic. So this isn't just one thing you do once a year and it feels a bit like a tick box exercise. This is something that shows that you're genuinely engaging, and all of us can do this, irrespective if you're a manager or a peer, to find out how your colleagues are. And they should be inclusive to understand what's happening in an individual, not being intrusive, but being inclusive, to find out what's happening and how we can best support colleagues. But they shouldn't be therapeutic interventions or performance related or a formal risk assessment process. So they can build on existing risk management arrangements you have, but they're a much more fluid and dynamic conversation to have. I hope I've achieved that within 10 minutes, Elizabeth, but back over to you. Thank you.
You did great, Steve. Covered loads of stuff there, and it's really great to see this information before it's launched. So am I right in saying you said Friday this information will be available?
Yeah, Friday will be available to all. If you're able to come along tomorrow, I'm sure colleagues on the call will be coming along tomorrow. But again, this isn't your only opportunity to attend one of these sessions. Particularly at the start of the next financial year, we'll be doing a lot more sessions for health and wellbeing guardians, for health and wellbeing conversations, and for champions as well. So there's an awful lot we'll be doing in the coming year.
Lovely. So we'll put a link in the chat box for where people can find excuse me, some more information about where to get the documents from Friday. So following that, we thought it'd be great, and I'm absolutely delighted that we're joined by Reverend Andy Dovey, who has been doing these conversations, these wellbeing conversations. And Andy, you've been part of the conversation on both sides, haven't you? Oh, you're just on mute at the moment.
Yes, sorry about that. Yes, you're right. I have been on both sides of the conversation. So it's given me an opportunity not only to have those conversations with our staff and volunteers, but to be on the receiving end and to know what it feels like as well, and to know what the benefits are for me personally.
So, Andy, what did you find useful about those conversations?
I think the most important thing for me was that somebody was interested in me. As the chaplain here at the hospital, I see some pretty horrific things, like a lot of our doctors and nurses. And when somebody asks you, how are you? And my normal response to everybody is, yes, 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 I'm fine, thank you. How are you? And when they turn around and go, no, we're not talking about me. We're talking about you. How really are you? And it's when you have people do that to you and say that to you, that you do take a step back and you think, okay, the facade didn't work. That face that they expect from the chaplain, which is always a lovely smile, regardless of what you've just come out of, doesn't always work. And they know when you're in pain or when you need a conversation. And to have somebody to say to you, no, how are you really, just opens the door to having a proper conversation.
Mm-hmm.
And so many have said to me, why don't you come and have a cup of tea? I'm going back to my room. I've got the kettle. Let's have a cup of tea. And, to talk about the things that are troubling you at the moment, they can't fix them. They can't. We know that. And it's a bit like some of the stuff that I do. I can't fix it. But the fact that you're having the conversation, the fact that somebody's actively listening, and that's really important, and not interrupting you, but actually just repeating back some of the key things that you've heard, that you think are the most important things that they're saying, gives them an opportunity, or me an opportunity, to hear what I'm saying and make me realise sometimes what the really serious things are for me that are affecting my well-being. And it gives you that opportunity to go away and think about it, and think about, what can I do about that?
Mm-hmm. Andy, what you just said there, it was really powerful. You said someone was interested in me. And that just took my breath away for a moment.
Yes.
Because it's, we all come to work to do a good job. We've all got something else going on as well as work. And talking to one of my colleagues, Claire Parker, who's been working really hard on these wellbeing conversations, she was saying to me, some of these conversations that come up, there might be something that nobody knows anything, the line manager or the peer doesn't know anything about. But it's just that listening, isn't it?
Yes.
And that support.
Yeah.
I was just, sorry, carry on.
No, go on.
Oh, I was just going to ask, before you did any of these wellbeing conversations, did you have any concerns or anything, or any worries or any questions before you did them? Yeah.
What if they want me to do something about it, and it's not my area and it's not my expertise? Mm-hmm. There was that. There was also the likelihood that I could be starting a conversation with somebody that's about to have a breakdown, burst into tears. How am I going to handle that? And I think we do. I have to say, a couple of times I've been in tears with them as well, because it's been so powerful what they've said. And that's not a bad thing either. Mm-hmm. Because if we can share their pain and their concerns and talk to them about it, I think that's something that's really good for them. Yeah. So my main concerns were, was this conversation going to get out of control? Was it going to become a rage that they've got? And we've never had that, but we have had really good conversations. So I would encourage everybody to have those conversations, and don't be afraid.
Don't be afraid. We'll take that on. And I think it's also about signposting, isn't it? So knowing what's available before you have those conversations, whether that might be things that are available from the national offer. And I'll do a little plug there, people.nhs.uk. And we've got another website as well. We'll put those in the chat room. But there's that available nationally, and there's local initiatives as well. And there's national non-NHS ones, offers available as well, aren't there? But don't be afraid. Have you got, Andy, one key message? So if everybody today was thinking about, I'm going to do a wellbeing conversation, I'm going to ask that second no, really, how are you? What would your one top tip be?
Don't be afraid.
Yeah.
Just if you think that you can see somebody that looks as if they're not as happy as they should be, or they're down, don't be afraid. Ask the question and insist again by asking the question again, so they know that you truly do want to know, and you're not just doing the blasé, hi, how are you? Hope you're okay. See you later. That's not what's going to help them. Don't be afraid. Just go for it, honestly. And you'll be surprised at how many people will come back to you and also start looking after you. It's something that comes back to help you.
Two-way. Well, thank you, Andy. Really, really much appreciated. Thank you for joining us, and thank you for sharing your words.
No problems. Thank you for inviting me.
Please do have a little look at the chat, and there's quite a few thank yous and comments in there for you. So we have Professor Neil Greenberg with us next. Neil is an academic psychiatrist, consultant occupational and forensic psychiatrist at King's College London. Also very heavily involved in the National Wellbeing Programme as well. So Neil, over to you. Tell us about you and how we're going to recover people to recover services.
Thank you very much indeed, Zoe, for having me come and talk. So I'm Neil Greenberg. I am a psychiatrist. If you're into Twitter, there's my Twitter handle down there, and I try and pump out the research that we do along that Twitter handle. So actually, I served in the military for 23 years, and I worked down at King's College London, and I've been very lucky to work with the NHS people team over the last year and a bit. It's been a real privilege. And I hope what I've got to talk to you about today will provide with some useful tips in terms of what you might do. So in terms of sources of actual information, you can see here all different sites, but basically this is the King Centre for Military Health Research, and this is our Health Protection Research Unit. The reason I put them up is if you are after the academic papers, then they're downloadable there for free, which is always useful. No doubt over the last year that things have been pretty tough for lots of people. There's been lots of trauma, workload and shift patterns. I don't need to tell you about it. It's been a challenge for many of us. Stuff goes on at home as well, which has been really important, particularly in terms of bereavement and financial loss, because we know that those two factors are particularly important. And of course, there's been this issue of what's called moral injury. A moral injury describes a situation in which something happens that strongly clashes with your moral code, and that really creates a sense of either anger, guilt, or shame, which is quite impairing. And I put on the bottom here this kind of spectrum-like approach, which is that many of us, hopefully most of us, are well. We all have some situations from time to time where we think, was that right? Did I do the right thing? Did they do the right thing? Then moral injury describes when those feelings become embedded and they start to cause you to have difficulties on a day-to-day basis. It's not an illness by itself, but it makes you vulnerable to develop illnesses such as post-traumatic stress disorder or depression, which we know about. And moral injury can occur because of things that you did or things that other people did, things that you didn't do when you think you should have done, and also feeling let down by people who you really felt that you could trust. These sort of three situations can leave you with these really strong and challenging emotions. This is a study we're doing at King's College London, also along with UCL. We've got 18 NHS trusts with around 27,000 people in the sample. And this is people quite right across the NHS in secondary care. So it's not just clinicians, although it does have clinicians in it. It's the porters, it's the cleaners, it's the administrators, it's people in the NHS. And what we did here is to split into people who had low moral injury exposure, moderate and high. And I won't go through all the different graphs, but these are all different sorts of mental health difficulties. And what you can see here is people who have a lot of moral injuries, who really don't feel that things have happened the way they should have done, are much more likely to report any one of the mental health problems that we looked at. And at the heart of moral injury really is that I did my best, but it really wasn't good enough. And I think many of us, perhaps at times over the last year or so, have had that feeling. So what can you do while staff are working really hard? Well, we know there's a huge literature out there on social support, and we've obviously been talking about that a bit, which is great so far during this session today. But one of the things you can formally do is to buddy people up on a shift. So rather than just say, look out for each other, you can say, Sandra, Peter, what I want you to do today is to check in with each other every hour, and that's part of your job. So you can make it part of something that they do. But probably the most important thing that we know is about this impact of supervisors, and that's already been mentioned today a number of times. There's great evidence from the emergency services and from the military, and I apologise I don't talk more about research on healthcare workers, but actually you'd think there'll be a lot of it, but actually there isn't quite as much as you might think. But this shows that the people who are your immediate line managers, your supervisors on a day-to-day basis, is that their attitude and their approaches towards you have a huge impact on your mental health. And the research shows that probably if you have a team who think their supervisor is good and looks after them, they can have 1/10 of the rate of mental health problems compared to people who don't. So it really is important that they can have what we call these psychologically savvy chats. So Steve's already mentioned that one of the things that's happened and is about to happen more, we're going to roll this out in terms of train the trainer across bits of the NHS, is this REACT training. And what REACT stands for is recognise, engage, actively listen, check risk, and talk about a specific plan. And it's basically a simple model of active listening, aiming to try and upskill people in supervisor positions and in caring and supportive positions with the skills and confidence to have those conversations. This training, as it was done here, was done over an hour using Zoom, where people attending saw a short sort of presentation, a demonstration, and then they got practicing using the template in breakout rooms, so they actually went away not just with information, but with an improvement in their skills. And we did a little evaluation that's just about to get published in Occupational Medicine. And this shows that before the REACT training, over half of the supporters didn't feel confident. They were underconfident. 1 month afterwards, nearly 85% felt confident in delivering those wellbeing conversations that are so important. So what this says is a bite-sized piece of training can make a really substantial difference in supervisors' confidence to have those conversations that we know are so important. Another thing that's been mentioned is peer support, and that's great. Good evidence that peer support makes a big difference. And the 4 key elements to what peer support should try and do is to provide someone to listen. And I think that's great. We've heard already that having someone giving you a proper listening to is really important. They should provide really basic, simple solutions, problem solving. And importantly, they should be able to identify people at higher risk and not just say, oh, go over there, but actually metaphorically put their arm around them, and I do mean metaphorically, and actually help make sure that they go and get the help they need. Because we know that many people who do get advice to go and get help don't unfortunately feel able to take that first step, which is of course incredibly difficult at times. One of the ways, not the only way that this is done, is through a system called TRIM, which is Trauma Risk Management, which is a peer support system that started in the military. And the reason I mention it is it has a lot of academic evidence behind it. We've done over 13 academic papers now, and this is a way of training up frontline staff. And they can be midwives, they can be anything along that sort.
Me have a problem. I have to share.
Oh, so people keep chipping in. What TRIM does is to try and help people support colleagues properly when they have a difficulty, so that they can go and get
out of here,
help.
man.
Motherfuckers! Hello!
Just leave.
Alfredo from
I'm
Portugal.
for this. We won't be a moment. I've got a few colleagues just working on it, so we won't be just a moment. I think it's gone now. Thank you ever so much, Paul. Apologies for that.
That's okay. No worries. So what of course we shouldn't be doing though is doing what's called psychological debriefing. So what I'm trying to say here, and this is a slide from the National Institute for Health and Care Excellence, is what this is saying is that the role for people like me, for mental health professionals becoming involved in managing critical situations or crises, our role comes later. In the immediate aftermath of a difficult situation, the most important people to support colleagues are their supervisors and indeed their workmates, and as well their family and their friends as well. So what there isn't a role is in saying, let's make sure there are psychologists or psychiatrists or mental health nurses available instantly in all departments. The role for us is to support teams to look after themselves. And what NICE say is that you should keep an eye on people, which is really important. And we'll come back to that in just a bit. Another thing that seems to help when people are having sort of acute stress difficulties in the workplace is to use this approach, which is called PIES. And I'll run through what that means in just a second. Good paper here. Again, this comes from the military, but this is the Israeli military. Study done in looking after the first Lebanon war, where the Israeli military had lots of people who had acute stress problems, unfortunately. And what they found was that the more these PIES principles applied when someone was acutely stressed, the better their outcome was 20 years later on. And as you'll probably be aware, you don't get many 20-year follow-up studies. So the 4 principles that you can do in the workplace, if you're a supervisor or indeed a colleague, is to, first of all, is called proximity. And what that means is someone's having a difficulty, don't just say, go home and sort yourself out or hope you come back when you're better. Instead, we should support them more in the workplace, and we should temporarily reduce their duties a little bit. So move them into a task that isn't quite so challenging, but it's still important. And that allows them to keep on going and then get ready and reset themselves to get back to their normal tasks. Immediacy says that if you've got someone who's having a difficult time, then don't just let them go downhill. Instead, have one of those well-being conversations, try and nip things in the bud, because if you can solve problems when they're simple, then that prevents people getting into crisis. Expectancy says that, when you're in the middle of a pandemic and you're working really difficult tasks, it's not unusual to have some symptoms. So if people have got a little bit of sleep problems, they're finding they're a bit more irritable than normal, but it's not really impairing. Actually, in the middle of a pandemic, that may not be a problem by itself. And what you can do is to reassure people that as things get better, so will their symptoms. But the other part about expectancy is if they don't get better or if they get worse and they start impairing you, then the expectancy is we're in it together and we're going to make sure you get to the right help. And the last thing is simplicity, which is actually when people are having a bit of a difficulty at work and feeling acutely stressed, sometimes and quite often the solutions aren't mental health solutions, they are mentoring and support. And I'm really pleased to see sort of Project M as a great example of providing mentoring within the NHS. Because if you're really stressed because you can't do a particular technique or process, or you're not sure what to do with a patient, actually you don't need a mental health professional, you need a colleague or supervisor to help you know what to do better, because that will reduce your stress. And then we come on to hopefully the period that we're getting into, which is this recovery and evolution. And I've called it that on purpose because I think many of us would agree that even before the pandemic, there were some big challenges of working within the NHS. And I don't think we just want to recover to where we were. I think we want to evolve into a better place, which hopefully should go on. So the first principle here of what you can do as staff begin to get into recovery and evolution is to make sure you give people a proper thank you. And that's not saying, just hi Neil, thanks for your work. It's saying, dear Neil, thank you so much for your work on Maples ward and the team that you were part of. Try and make it as personalised as you can, because the more personalised and truthful and honest that thank you is, the better it can be. You've probably also seen, and I've seen lots of these good examples on Twitter, of trusts that have done amazing thank yous to family members as well, sending out thank yous to people's children, saying thank you for letting your mummy or daddy come to work. And I think that's another example of showing that actually we are all in this storm together. And another thing that can go on with that thank you is a reminder of services available. And you've already seen from Steve, the NHS People national offers, and of course there are lots and lots of local offers depending on where you are across the NHS. So reminding people that these services are there is also really important. The next thing is about actually not just jumping from one intense period of work into another. And I know there is a real challenge here because we do want to recover our services, but actually there is a good opportunity to take leave because actually taking the leave in the right time frame, so doing it when people really need it, which is sort of now, is much more likely to lead to long-term benefits, even though it might seem that in the short term, actually, how can we cope with leave? There's so much to do. And actually, there's been some modelling done, which basically shows that actually, if we do invest properly in people's leave now, then actually that will pay substantial dividends later on. And that's a chance to reconnect with loved ones, have some downtime and switch off, go for a walk with the dog, and also a bit of time for personal reflection. Because there's very good evidence that actually when you're in the middle of a of an intense situation, sometimes you don't really think too much about the meaning and the impact of what's going on. You just crack on and get the job done. And actually, at some point, there is going to be a need for reflection, and leave can often be the first time that you might actually begin to try and make sense of the enormity of what's gone on over the last month or year, or however long you've been working on these really difficult tasks. And talking about reflection and going back to what I mentioned about moral injury, is there is a need to have some sort of reflective practice as a team. And what reflective practice does is to try and create what we call a meaningful narrative. And that is a story in which actually it wasn't all down to me, I didn't do enough, and it wasn't all down to my boss didn't support me or my colleagues didn't support me. It comes down to the fact is, even though I didn't feel in the same boat, we were all in that same storm. And actually the discussion that needs to go on with reflective practice is one where actually the people who are in leadership roles need to start off perhaps by saying, actually, I didn't always have the answers either. At times I felt I was letting you down, because actually everybody has been in that situation over the last 12 months. Or if you haven't, then you're a very, very lucky person. And what this reflective practice can look like is basically a chance to talk about some cases, not so much to talk about the facts, although talk about them briefly, but really what the impact was been. What did that make me think? What did that make me feel? How did that affect my behavior? How am I now? And then what does this mean? How can we move on from this? And actually come to realize that actually it was the situation that was incredibly difficult. It wasn't that I was let down. And the evidence is that this can improve people's stress and also improve working relationships as well. You may well have heard of Schwartz rounds as being an example of reflective practice, but there's no reason that as a team, when the time is right, that you can't do this and actually try and come to this kind of narrative where it was really difficult, but actually, we all did our best, and actually we did an awful lot of good. And then we get back to those supervisor discussions, and actually there's really good evidence that actually the impact of these supervisors on well-being of staff makes a big difference. Good paper just came out recently this year, was about health promoting leadership during an infectious disease outbreak. Now, this was in the US military after deploying to Africa. But actually the important thing here is that having a leader who's able to sit down and talk to you about the impact of what's gone on actually was shown to actually lead to a positive outcome in terms of reducing the chance that people went on to develop mental ill health. And so what this return to work interview should look like, and I was just talking to an NHS trust just before this meeting about a template to do this, is about how are you, what's happened to you, what's happened at home as well, because, bereavement and job losses and child difficulties or whatever else might have gone on, those also impact upon people's well-being. It's not just what's happened at work. So first of all, find out how someone is. And then, of course, the key question is, what can we do to help? How can we make the next few months actually a process of you reconnecting with your work and actually trying to actually grow and move on from it? And there's very good evidence of a concept which is called post-traumatic growth, which put simply says that anything that doesn't kill you makes you stronger. And the evidence is that actually many people who go through these really, really tough times actually come out of it not just okay and not ill, but actually psychologically stronger than they were. And the Royal College of Psychiatrists has its recovery plan entitled as Going for Growth, because I think what we want to do is not just to think about how do we avoid people becoming unwell, although that's obviously important, but the real thing is how do we want to help people? How can we help people to grow and move forward and actually take away from this experience that they can cope with adversity far better than perhaps even they thought they were able to. And then the NICE guidelines are very clear that what should happen is that organizations should do what's called active monitoring. That's keeping an eye on people. And that's not just talking for a few weeks, because the chances are that the real impact of this pandemic on staff mental health, will not come to be clear until some way down the line. So what that means is keeping an eye on people over the next months and probably, to be fair, over years as well. And what we think here might help is to use what's called a self-check tool, which is basically a way of an anonymized online tool that will enable people to do a check on how their mental health is. No one knows who they are, so they don't need to feel worried that someone's going to come and find out about their results. And then based upon the scores on that self-check tool, it will direct you through to resources that might help you, including in some cases, potentially an opportunity to connect yourself into one of these wellbeing hubs that are in existence, so that if you want to get the help that you might need, then you can directly go through and get it there. But you can start off with checking on how you are without having to be worried that someone might find out how you're doing. And then lastly, what's important is that if you are unfortunately unwell, is that you can get to having occupationally focused mental health care. And there's absolutely a role for counselling and support for many people. But if you unfortunately do happen to develop post-traumatic stress disorder, or if you've developed depression because of what's gone over the last year, what we need to make sure is that you get forward and get to the help that you need. And the wellbeing hubs are going to aim to provide evidence-based assessment so that actually you can get a proper assessment and get you on the right treatment pathway and get you that treatment and care you need. Now, actually, in the UK, we have what's called the Military Covenant, which actually is all about military veterans. And it quite rightly says that if military veterans have been damaged because of their service, then they are entitled to a specific access to mental health care. And there are mental health services for veterans in the UK, because there is a recognition that veterans may be damaged by their service. Well, it clearly translates that over the last year, the NHS, many NHS staff have been at risk of being damaged because of the service that they've given to their nation too. And these wellbeing hubs, I believe, provide an opportunity to make sure that actually it doesn't just mean that morally we do the right thing, but also we really want staff to get the help they need quickly, because we want them to get back to work, which is good for the NHS and obviously good for them as well. So my conclusions of my presentation is that we shouldn't over medicalize normal distress. Many people will have symptoms out there, and actually that's not surprising given what's going on. But symptoms by themselves don't make you ill. It's the impairment that makes you ill. It's where they start to interfere with your life. And what we really want for people to nip these problems in the bud, because actually if you can solve things when there actually aren't major crises, then that means that they don't develop into the crisis, and therefore you don't need the mental health care. In some cases, inevitably though, even with the best managerial and colleague support, and some people will go on and become unwell. And the most important system to try and support mental health isn't people like me in the first instance, it's the team. And that means having good support and particularly having supervisors who feel confident to have those wellbeing conversations. I spoke to you about these pies, the proximity, immediacy, expectancy, simplicity. And that basically tells us that if people are distressed in the workplace, don't just say go home. Instead, say, how can we support you? What can we do differently in the short term to try and get you to recover? And actually, the evidence is that works, and it's good for them, and also it's good for their employer as well. And then when we come to recovery and evolution, which hopefully we're coming to now, don't forget those principles that I went through: a proper thank you, a graded return, some reflection personally as a group. Make sure you have a return to work interview. Keep an active eye on people for a good period of time, and a self-check tool can help that. And then make sure they get to evidence-based care if they need that. So that's me. I hope that was useful, and I will stop sharing my screen.
Wow, what a presentation of a lot of content. So thank you ever so much, Neil. There's been lots of questions about will the slides be shared, and can we share those on our website?
Yep, I'll send you a copy through.
So all of the slides will be available, and a recording so you can watch it back, will all be available on the Horizons website. So I'm going to go back and have a little look at the pies, because I thought that was really nicely broken down into what to do and how to do it. The thank yous, what a simple thing to do, but really make them personalised. And I liked your point as well, Neil, about reflective practice, but not just on your own, as a team and as a group. So please do have a little look at all the questions in the chat box as well, Neil. So thank you ever so much for your presentation. I was wondering now if we could pop a few things in both the YouTube and the Zoom chat box. Maybe one thing that you're going to do from the presentation today. So whether that is from Neil's presentation about recovery, or is what we heard from Andy and Steve, or what we heard from Alan about Project M. So please do pop in the chat box. What are you going to do from today? So Claire Parker is going to publish all the resources. Claire's working on the wellbeing conversations. Valerie's talking about better care. Paul, it's going a bit too fast for me to read them now. Can you pick a few out, Elizabeth?
They're coming thick and fast. The big learning for me is not to send people home straight away, but provide that support at the place of work. I really like that. Thank you, Neil. Lots coming through. Reflective practice, great. Self-assessment monitoring tool. Lots and lots of good ideas coming through and learning.
Lots of good ideas coming up. I'm going to ask my colleague Paul to put a poll up for us. Our question on the poll, if you can see it in Zoom, then please do use Zoom. If not, please use the chat box as well and in YouTube. So to what extent has today's session been useful in your own role in supporting the health and care of the health and well-being during and after COVID-19? So we've just got those coming through now. If you can't see the poll, it's 1 to 5. 1 is not helpful, all the way up to number 5, which is very helpful. So I can see those coming in now. And we'll just wait for a few more votes and we'll share the results. So they're all 4s and 5s, it seems. So thank you to our presenters today. I've got one final slide to show you, which is all about our next events, which I seem to not be able to pull up on my screen, but don't worry, because I can see it. So our next events are, we've got our Project M tweet chat, which is on Tuesday, the 30th of March, and we've got our next Wellbeing community event, which is the 14th of April at the same time as well. So without further ado, I do hope you have had a good session today. Thank you, Paul, for joining, for putting the slide up for me. I've learned a lot. I hope you have too. Please keep sharing on Twitter and we'll get all the slides out and the recording so that you can review those as well. So thank you. Have a lovely evening and look forward to seeing you soon. So Paul, please could you pop the slides down for me? Usually there's a bit of a wave that I do see. There's Stephen, Rachel, I think I saw a little one in your camera. Thank you for being with us and thank you for bringing her along as well. It was lovely to see her. Hi, Louise. We'll see you all soon. Karen, hi. Joanna, Ian. Joanna, Rory, hello. Jill, hi. See you all soon. Take care.